Thank you again to the planners for allowing me to present this abstract and to Dr. Golzar for this meeting. So I'm going to talk about predictive risk factors for TLR. Here are my disclosures. So what is the advantage of real-time OCT guidance? We talked about this during the lunch session about visualizing plaque, and Dr. Dohad went over the advantages of intravascular imaging compared to fluoroscopy-based imaging for treatment of vessels. But it allows us to visualize arterial borders, to guide treatment boundaries, how far you can go with the treatment. You can visualize the media, the external elastic lamina, as you see out here, and the adventitia to prevent cutting into the normal vessel layers. It allows assessment of disease distribution, the extent of plaque, where to start, where to stop, and to prevent geographical miss. So it's a real-time assessment of disease morphology. You're able to visualize luminal calcium. This shows again the intravascular popcorn calcium, the rough edges, and exactly how far it extends. It differentiates that from medial calcification, where you have a drop-off of signal within the medial layer. It shows you fibrous plaque, such as this, and eccentric plaque on just one side of the vessel. It shows you thrombus as well. And so this may guide your treatment after you visualize this within the vessel. Panteras is the real-time OCT-guided atherectomy device. It comes in an 8 French and a 7 French version over an 014 wire. And the OCT allows you to visualize, as mentioned earlier, and the cutter rotates at about 1,000 RPMs. This is what the catheter looks like. And again, direct visualization helps you oppose the cutter to the plaque. And the Vision trial data was presented earlier, and it showed that there was very little adventitial resection of less than 1%, essentially no adventitial resection with direct imaging. And that hopefully portends to decreased target lesion revascularization. So looking at the outcomes from this Vision trial, there were 2 questions that were asked. Does OCT guidance change therapeutic management and TLR? And then what does the tissue that has been collected tell us about potential risk factors for TLR? And so this is a total of 198 lesions within the Vision trial. Logistic regression analysis was performed to identify factors that are important both to OCT imaging and histology. And the 3 characteristics that came up as being significant and related to TLR were thrombus burden, degree of adventitial invasion, and smooth muscle cell rich media extraction. And I'll go into the details of that in just a little bit. And this is from direct tissue analysis from the trial. The IDE trial, just to remind you again, was patients with de novo lesions in the SFA popliteal space were treated with OCT-guided atherectomy. Tissue was collected from the nose cone after atherectomy and follow-up over 6 months. So this is the regression analysis chart. So this is a busy slide, but I'd like to point out 4 different attributes within this subset that was identified as being significant or as correlated to TLR. And that's baseline stenosis, so we know that. That's a fluoroscopy-guided degree of stenosis. Baseline lesion length, again, fluoroscopy-guided length of the lesion to be treated. And then OCT-guided characteristics, which were the diagnostic gap, which Dr. Dohad already went over, and that is the difference between what was determined to be the lesion length by fluoroscopy versus the OCT-guided intravascular imaging lesion length. And so that delta is the diagnostic gap. And then percent residual medial content. And so this is smooth muscle cell rich media that was left behind, so residual medial content. And so if you look at those 4 attributes, and so these last 2 attributes are primarily from the tissue analysis and the OCT imaging, and the first two are from fluoroscopy imaging. And if you looked at equal weighting of all of those 4 attributes, we found that that was significant. Those 4 attributes significantly contributed to TLR with the p-value of 0.034, which was significant. So again, this is a retrospective analysis, subset analysis from the Vision trial to find what could correlate with TLR. And so the takeaway here is that it suggests treating longer lesions using OCT and treating beyond what you appreciate from just fluoroscopy-based imaging, and removing the smooth muscle cell-rich media may lead to decreased TLR. So the 2 questions that we asked up front, does OCT guidance change therapeutic management and TLR? Yes, if you treat lesions aggressively and treat the edges more thoroughly and avoid adventitial cuts. And then what does the tissue tell us about TLR risk factors? Thrombus is more abundant in long lesions, and it does correlate with TLR. And media-rich in smooth muscle cells may predict higher restenosis. Thank you.